Most of you taking your GLP-1 medications like semaglutide or tirzepatide will flat out stall or crash, or even worse, turn into a literal zombie because you're not being instructed and coached on what exactly is happening. The metabolic plateau, the weight loss plateau, it's happening all too common. Trust me when I say this, my name is Dr. Jones. I've helped thousands of individuals achieve lasting weight loss, both before GLP-1 medications and now with it. This thing is a real phenomenon, and you need to understand how to avoid it, which we're gonna get into in this video. This might sound crazy, but eating closer to 1800, give or take. So that might be your reason to decrease the medication, because the question comes up for people when they do a reset, can I just stop the GLP-1 entirely? I can't give you that medical advice, but that actually might be an option for you, or you might want to severely reduce it, at least maybe reduce it and then stop. That's going to be your call. But if you just cannot eat more food than you're eating now, then you're going to have to remove the barrier of eating more, which is the medication. Does that make sense?
Yeah, I don't have a problem with wanting to eat. It's a problem of time to eat and time frame and eating right
Okay.
stuff. So I'm not able to do that every day.
So we're going to talk about food here in a little bit, but let me get this. These dogs are begging to come out of my room. They asked to come in and then they asked to leave. So superfood shakes, blending a lot of healthy, nutritious food into shakes might be a solution to help you eat more. But at the end of the day, it's going to be a planning issue. Is planning to have better food available around you. For a lot of people on the GLP-1, it's an issue of just not being able to finish the food, not because they're always full. Right. But if that's not the issue with you, then it's just more of a plan, right?
It's Marzina Rudik.
Ooh, that's hard to say. Okay.
It's hard one, yeah.
You have not taken GLP-1s before. Okay. Do you happen to know how many calories you think you average per day?
I usually eat around 2000.
Okay.
That's what I've counted before. Lately, last month, I scaled back and I actually gained weight.
Yeah.
And that's why I decided to sign up for this program, because something is off.
Sure, for sure. Okay. So only in 1 week you try to eat less, or for an entire month you try to eat less?
Entire month.
Do you know how much less you were eating?
It was between 1400 to 1800.
Okay. So probably what happened was you scaled back pretty quickly, which kind of shocked the body, and many reasons why the body does it faster for some people. Some people don't ever plateau. They can just starve all their weight off and they're okay, but other people can't. Let's do a mini reset for you. So for week number 1, we're going to start you off at that 1800 range and see how your body does, where you eat 1800 and you start counting your calories. You're accurate for 1800.
Okay. Does it matter how many times I eat, or can I consume 1800 like once a day, one meal?
Yeah. So if you could get it all in one meal, I'm okay with that. It doesn't matter, although that's going to be challenging. Maybe it's up to you, but in theory, you could do it over 1 or 2 meals and I'm okay with that.
Okay.
So obviously healthy, nutritious food, you can think with that. And we're going to talk about that here in a second. Okay. Esmeralda, how are you? So you're eating about 1200 calories.
I've been counting my calories lately. It's about 1200, 1300. I struggle to get that much amount. I drive all day, so I struggle to eat.
You're not taking the medications right now?
Yes, I was told to start taking it. My first dose of the tirzepatide was Sunday.
Okay. So.
And I've been taking the AODs on a daily basis.
Okay. So let's talk about both of that right now. If you guys are in a reset, by the way, you can take AOD. AOD is an awesome, very safe peptide, doesn't affect your hunger one way or the other. But just keep in mind, if you do, we give you enough AOD assuming you don't need a reset. So if you do start your AOD because you want to benefit, you will need to purchase more. And I'm not making that a requirement. So that's your choice, because it's finances. I know AOD is not cheap. So just keep that in mind for everybody. AOD is optional. Now, for you, if you're saying you struggle to eat, I probably would not start the GLP-1. You already took your first injection, so that's not the end of the world. But I wouldn't keep up with the GLP-1 until you finish your reset, especially if you're telling me that you've been struggling to eat enough already, because the tirzepatide is just going to make it even harder for you to eat enough.
Yeah.
I would hold off on that. I would wait. Let's get you through the reset. You said you've been eating about 13 to 14, or you've been eating about 1,200, you said?
12 to 13.
Okay. So for your first week, let's go for about 1,400. Let's make that your next week. Your target, your daily target is going to be 1,400 a day. So now let's talk fasting. So as you read, there's 3 stages of fasting, but since you guys are all on the reset, I could talk to you guys all on the same thing. So intermittent fasting is okay. I'm okay with you guys doing intermittent fasting, which is your daily kind of compressing your eating window. Usually I'm a fan on the daily perspective of an 8-hour eating window, eating 2 to 3 meals. In theory, somebody mentioned 1 meal a day. 1 meal a day in theory would be great, but the reason why practically I see it not work that often and why I don't do that in my protocols is because it's really easy to start under eating when you're doing 1 meal a day. And if you're counting everything, that 1 meal for the rest of your life, and then it would be great actually, but most people don't. And so that's why getting enough protein, getting enough calories, getting enough fiber, it's just hard over 1 meal. So that's why on the daily, I like the idea of 2 to 3 meals over an 8-hour window. Now, as soon as you guys are done with the reset, which we will tell you because you're texting us every week with your update, one of those responses is going to be, congratulations, you're done with the reset. As soon as the reset is done, that's when you can start getting into the deeper stages of fasting. And so I don't need to spend as much time there today since you guys aren't going to be there. I want to focus on what's more relevant for you then. So really make sure you also review those fasting instructions when you get there, because as soon as the reset's done, that's when you can start your GLP-1, and that's when you can start cranking up the fasting and getting to that longer fast as quickly or as slowly as you want. And those instructions will lay it out. And you can ask any follow-up questions when you get to the implementation calls. Any fasting or reset instructions so far? Okay, cool. The diet, people can make this really complicated and you don't need to. The most important rule is reducing the amount of food that you eat is processed. And I think most of you guys know this. You've heard this before. I don't think it's realistic to say avoid all processed food. I don't think it's realistic to say never have a gram of sugar for the rest of your life. That's just not sustainable for most people. So I'm asking you guys to adhere to that 90-10 rule. If we can keep 90% of our food clean during this program, give yourself some cheat meals, 10% of your meals, 2 to 3 per week. I'm okay with that. Doesn't mean go crazy for a day, but it means if you want to have something that you know is in the category of processed, go for it. In 10%. And so when you guys hear me talk about Paleo Mediterranean, those are really good examples of what this looks like as far as structure. But there's a ton of foods that are not processed. So just think of meats, legumes, vegetables, fruits, nuts. That's basically your choices for unprocessed food. Organic is always ideal. If you can work that into the budget, it does make a difference, but don't freak out if it's too expensive. Just work within what you can. The only modification we're going to do to the anti-processed food diet is we are going to go keto for this first 2 to 4 month period. It makes a huge difference because in addition to the fasting, the combination of both is very powerful for healing your insulin resistance. So we want to get in front of that. My goal for all of you guys is 2 to 4 months from now, we start introducing carbohydrates. Even if you're not at your weight loss goal yet, we start introducing carbohydrates, and it's a test. Because if we can start eating more carbs, not high, but we go from low to moderate, and you're still losing weight, but now you get to play with carbs, it makes it funner. It makes it more enjoyable. So it's a nice target in the back of your mind. Let me do this for 2 to 4 months. And that's really it. One more aspect of food is protein. So protein is vitally important for a ton of reasons, mainly protecting your muscle mass. Also, protein just keeps you full for much longer than any other. Up there with fat and protein, both are really high on satiety. So a simple formula is your current weight between your current weight and your target body weight. So if you weigh 200 and you should weigh around 150, I want you to be striving for consuming about 150 to 200 grams of protein per day. I don't make you guys count your macros, but protein, if you think you're under eating protein, then this is one macro to count just till you get used to what 200 grams, for example, if that's your target, what it looks like. Then once you're really comfortable knowing that I'm getting somewhere around that range, you don't have to worry about counting your macros. Protein powder is vitally important if you can't get enough protein from whole food. So I'm okay with powders, and I need you to do powders if you're not getting enough from food. I don't want you doing powders and getting it all from powder, of course, but there's times where it just happens. And I need you to get your adequate protein intake. So I'm okay with powders when you need them.
What about the protein shakes?
Yeah, protein shakes. Oh, you mean ones that are already made?
Yeah.
Just be careful with those because they're convenient, but they sometimes have a lot of sugar. So if you can find one that's very low on sugar, ideally low in fat, because you don't need, unless you're doing it as a meal replacement, then they make some with fat and protein that are really healthy. I don't know if you guys seen the ads for Kachava. It's this supplement that's a meal. It's super healthy. It's expensive, but if you're on the go, Kachava is great. And that has fat and protein and carbs. But if we're just trying to supplement our meal, you just want pure protein to go alongside your meal.
Okay.
Is this one okay?
So Premier, I get asked that a lot because Premier protein tastes so damn good. Oh my God, it tastes like you're eating a shake, you know. The quality is low. It's got a lot of fillers. I want to be careful because I'm not saying, am I worried about some of those occasionally? Not at all. In fact, if you were going to treat yourself, you could make a really delicious treat out of those. You can blend it with other things and your calories are good. So I use those to make treats. That's how I look at a Premier protein shake. It's not ideal. I would rather you as a base protein have another one, but because I know how delicious those are, you can use those as treats, absolutely. They have some really good flavors. Was that the cinnamon one, the cinnamon bun?
That's
Caramel. I like the cinnamon bun one. That one's pretty good. I use that one every time to time. But my favorite protein powder I have on the Welcome to form, whey protein is solid for muscle building. We're going to talk about muscle building later. So a good whey protein powder that's low in sugar. You don't have to get my brand, but mine, the one I have on the Welcome form is just plain with no additives because I then blend it with stevia and other things as well. If you want a powder that's already flavored so you don't have to blend it, then a different brand. As long as it's just low in sugar, ideally organic grass-fed whey. That would be a good base. And then you can have the Premiers occasionally. There's some other pre-mixed shakes. Choco makes a good brand. And as long as it's low sugar, that's the big thing. And a higher quality organic. Okay, cool.
For the keto period, how many carbs are we talking? No, 20, 50?
50, I'm okay with 50 or less net carbs per day. So net carbs means carbohydrates minus fiber.
Right.
How about non-strict carnivore diet with, for example, avocados, cheeses, and stuff like that?
So carnivore diet is, for somebody, it's very hard to do, right? Carnivore is strict, but for some people, their gut is reacting to so many things. I think carnivore could be a good thing for a couple months and then introduce food later. If you're talking about what you're talking about, carnivore with like you said avocados and
like some fruits, like healthy fruits. I'm talking like berries and avocados and stuff like that, like apple a day.
I'm okay with that. Yeah, I think that's great because what we're doing is it's making it easier for you and your brain to structure around that, and you're removing processed food. So I'm okay with that. Yes. Obviously, most people after a couple months of doing that, it gets really challenging just because you start to miss other foods. But if you want to start for that for a couple months, yeah, that's great if you can adhere to that.
I was on carnivore once. It wasn't easy at the first, I think, 2 weeks, but later on, I loved it because it was so easy to prep. I didn't have to think about it.
Right? No, for sure. I totally hear you on that. Okay, so supplements, guys. There's a ton of supplements out there in the world, and so I tried to break it down for you guys. By the way, in case you didn't know, you can click these links here and it will navigate to the section. So if you click number 6 and then you click this, it just takes you down. The only supplements that I'm saying are mandatory are these ones right here. And you don't have to take my brand, but if you don't have them and you want to purchase the one I recommend, these links take you to full scripts and you can order them right there. If you already have your own and it's a good quality, I'm okay with that as well. If you're watching these clips from my coaching calls and wishing you can be part of the team, I'll put a link in the description, but we have thousands of individuals who are kicking ass using microdose intermittent use protocols and implementing sustainable lifestyle strategies, guys. Click that link, fill out your information. Now back to the show. As well. So just follow the protocol there on the supplements. Electrolytes are a big deal, especially when you get to long fasting. Once you get to the 24-hour fasting, you have to take electrolytes and you have to add some extra salt to the electrolytes. Just keep that in mind. If you do long fasting without electrolytes, usually you get muscle cramps, you get tiredness. It's not good. So make sure you add the salt and the electrolytes. Do any of you have an autoimmune disease or an inflammatory condition going on at the same time? Okay, good.
I have endometriosis, which is
Endometriosis. Okay, definitely you're probably working with your doctor on that, but yeah, that's not what I'm referring to here. So yeah, like an autoimmune disease, an inflammatory condition, if nobody has that, then we're good. Curcumin and resveratrol are still very powerful for reducing inflammation. I would say that's semi-required, but not absolutely required. And then the rest of these supplements, guys, are situational. So hold on, did we lose somebody? No, we didn't. Okay, good. Go back to sharing. Since all of you guys are going to be in a reset, you absolutely need to buy this one right here, Thyroid CNV. You only need 1 bottle of that. Just take it as soon as you can during your reset. It helps your metabolism speed up as you're doing the reset. So you only need 1 bottle of this one. And since all 3 of you guys are in a reset, make sure you get that one. And then the rest of these supplements are situational. So if you have any questions at all during the program or now as well on any of the extra supplements, just let us know. All of these can be very helpful for any individual who has that problem. But the reason why I don't make them required for everybody is because it can get really expensive and overwhelming. So I try to break down the supplements to the absolutely required and then the semi-required, if that makes sense. Okay, cool. Appetite suppressing supplements. So my 2 favorite ones are the CaloCurb and the Unicity. The Unicity is a company that has 2 products called Unimate and Balance. So let me show you guys again. So right below here, some people do my program without the GLP-1. So obviously they're taking every single appetite suppressing supplement they can. For you guys, you're on GLP-1s. You're not going to need as much appetite suppressing supplements. But for example, there's all these different scenarios that can play out. So one scenario is taking the Unicity every day, taking the CaloCurb, and then staying on a lower dose of the medication the entire time. That's awesome, but I'm not telling you that's required. Some people use these situationally, for example, on long fasting days, because they're good on the other days because there's appetite, but then they struggle on day the 18 hours, 24 hours plus. So they take these on those days. And then also you can use these, and you will use these in the future when you're starting to wean off. So these absolutely are handy. And so they're not required, but can be very situational, and they're very safe to use basically whenever you need them for that extra appetite suppression. Fantastic. Okay. So stress and sleep supplements, guys. We're going to talk about stress and sleep, but I wanted to show you right here. This is the stress stuff, and this is the sleep stuff. So if you are dealing with any sort of stress in your life, you guys have heard stress is bad, and you know what it causes, cortisol spikes. And so those supplements are called adaptogenic herbs. And so I would get at least 1 or 2 bottles, take them for a couple months. I don't necessarily want you taking them forever. If you have chronic stress in your life, ideally the goal is to fix the stressful situation. Sometimes you can, sometimes you can't. If it's a spouse or a kid or a job, sometimes you have to deal with that. And if that's the case, adding a stress management technique can be very powerful. 5 minutes a day, like breath work, journaling, drawing, meditation. There's all these stress management apps. So I always recommend 5 minutes, part of your bedtime routine. That's it. Let's start off small, and you can always add more stress management if you really like it. If you feel really good, some people meditate for 30 minutes a day. I wouldn't tell you to do that, but start off with a small little 5 minutes a day. Even if it's not every day, start somewhere, and you can always add more from there depending on how you feel. Now with the sleep, very similar, but I would say sleep is also extremely important. Not getting high quality sleep spills into so many categories. It can make you more hungry. It can slow down your metabolism. It can mess up your hormones. It can spike your cortisol. It does a lot. And so 7 to 9 hours of quality sleep is what the average human should be getting. So if you are like, oh my God, I'm not getting 7 to 9 hours of quality sleep, then the sleep supplements, I would start with some of those because that can improve your sleep right away. But then I would focus on implementing the sleep management strategies. I have a whole hour-long video. It's on my YouTube page. Does any of you guys are not getting 7 to 9 hours of quality sleep? Okay. So Sassy, if you can send them the YouTube video, just because it's on my YouTube page, and we'll send you the direct link so you know exactly what video I'm talking about. When you have a chance, sit down, watch it, take your notes, and implement those strategies. The good thing about the sleep stuff is it's not time consuming. They're just things that you do to your environment, having a bedtime routine, setting your alarm, turning off the light. They're just little things that you wouldn't think of. So watch that video, implement them, and it'll just become part of your routine like brushing your teeth. Stress management actually takes more time because you have to go do that thing for 5 minutes. So sleep is a lot of things, but it's not time consuming once you get used to them. Okay. Any questions on stress or sleep or fasting or food or anything like that? Okay, good. The last thing to cover is exercise. Hands down, the most important thing is lifting weights. Weight training is vitally important. These medications are going to reduce your appetite, and reducing your appetite means muscle mass loss. The two things that you do to prevent muscle mass loss is consuming adequate protein and following a good structured weight training regimen. And I push it to an even higher degree, not just saying, oh, this is nice to do. Like long-term lasting weight loss depends upon you preserving that muscle mass. The idea of just saying, oh, I'll lose the weight and I'll worry about the muscle later is a really horrible way to look at this. Some people do it that way, and it is what it is, but you're gonna regret that in the future for so many reasons. Your health really does decline, and we understand this now. I would say the last couple of years based off research. That's why people are talking about protein and lifting weights so much more just in the last 2 years. I've seen so much more attention and focus on this. We'll start with you, Jeanette. Are you doing a good weight training program or no, not really?
I need a hip replacement and possibly a knee replacement. So I'm just now seeing ortho, just got a cortisone shot. So I was thinking about doing resistance because I can sit down, I work on my feet and I lift pallets and boxes up on the thing, but I can't do much more than that because I feel that.
Do you have a relationship with a physical therapist?
I did, but I can't afford all of that and this.
For sure.
So I have a little gym downstairs and I have a nephew who's into all that.
Oh, good. Perfect. Ask your nephew to set you up. And the biggest thing when you're lifting weights, if you have injuries, is understanding good pain from bad pain. You want to feel so let's say I'm doing a chest press, right? You have to feel the burn in your muscle. That's completely normal, right? So that's the whole point of lifting weights is in the beginning, I know it's a shock if you've never felt it before, but you get really used to it. You get so used to it that if you don't feel the burn, you're like, am I even working out? That's eventually what happens. So that's all good. If I have a shoulder injury, it's okay. You want to play with the range of motion, your shoulder position, so that you minimize pain in the joints. You should not be feeling pain in your joints, and you should not don't push over the pain in your joints. So work with your nephew to find the exercises that do not create pain in the joints and then work around that.
Okay.
Perfect. Okay, good. Jack, Mrs. Jack, how about you? What kind of weight training are we doing?
I'm not doing any weight training. Recently, I had a back injury where my 2 vertebrae, they're too close. So everything that I do, bending or I don't know, squatting and stuff like that, it hurts my back. But my job requires I walk a day, maybe sometimes over 20,000 steps I have.
That's great.
So I'm active, like I walk a lot, but not strained weightlifting and stuff like that.
So walking has its own benefits, but we need to figure out a solution at some time here. As much as, so what you're referring to is called degenerative disc disease, is probably DDD. And yes, you can aggravate that with resistance training, but what they didn't tell you is part of the healing process is actually resistance training. You just have to find, like Jeanette, you have to figure out which exercises you can do where you work around the injury, where you're not aggravating the spine, but you're working those muscles. So do you have, or can you get can you get your doctor to prescribe the physical therapist so you can go see the PT?
Sure.
I would do that to start off with and get really comfortable. Tell the PT, hey, I'm doing this weight loss program. They really want me to work out my muscles to not just lightly, but as much as you can around the injuries. And the physical therapist will say, sure. And they'll teach you the safe ones first, and then they'll progress you from there. And then possibly a personal trainer later, but let's start with the physical therapist first. Ceci, for both of them, I want you to follow up with them in about 3 weeks to see how the lifting's going. And then we'll go from there for sure. Esmeralda, same question for you.
I'm actually in another group, a WhatsApp group. He's a personal trainer, and he'll send us like a daily workout video. It's mainly weight training and weight resistance.
Good.
So
Good.
I try to do those 3 times a week.
Good. Are they more like at-home workouts, or is it like at a gym, or?
It's both. I don't have a gym membership, but I got a lot of workout equipment because of my teenagers at home.
Yeah.
So I take advantage of their stuff.
Totally. I always tell people that I prefer gym just because at the home, sometimes easy to get distracted really quickly and no, I'm going to go do the laundry, or especially as a mother, million things you got to do around the house. So just keep that in the back of your mind. But if you can be really serious about home, then I'm okay with that. And the big takeaway, guys, is you want to lift weights like you are trying to build muscle mass. And I know your goal isn't muscle mass growth, it's weight loss. Trust me, I get that. But if you train like you're trying to build muscle mass, it's called hypertrophy. You guys can Google that online on Google and learn more about hypertrophy training. We have really good videos on weightlifting. Ceci, if you can also send them the initial weightlifting video on FLOA University as well, just to get comfortable with the concept and then go from there. But if you lift like you're trying to build muscle mass, but you're following this protocol, you're going to lose weight, and that's going to help improve that you're losing just fat and not muscle mass. Cool.
How often should you do that? Is 3 times a week good?
If you do a solid 3 times a week, 45 minutes, that's plenty. Of course, you can do a lot more, but for starting out, I'm really happy with 3 days a week, 45 minutes. Really good workout, not distracted, doing other things, like there to train. And the physical therapist can teach you that. Eventually, a personal trainer is something to consider. And I'm going to see, depending on how you guys do, Ceci, we might recommend that later on. But okay.
I have one more question. So this is 3 months program. And what if after 3 months, I'm not reaching my goal weight? Can I get prescribed? And I don't want to take the tirzepatide for another month or so. Can I get prescribed? I think there was like, what's the with P? Phentamine?
Phentermine, correct. There's other weight loss aids as well. And in 2 months from now, we're going to do another small Zoom like this. And that's where we can discuss, because 2 months from now, we'll be closer to the 3-month mark. So on that call, that's where we discuss things like that. But you have a ton of options. You could obviously extend everything. You can extend just the coaching. You can extend coaching and the GLP or the PEP. Like, there's a lot of options to think about and consider. And we'll discuss all of those on another small call together 2 months from now. Obviously, it depends on finances, depends on your progress, and we'll figure it out together. Fantastic. Someone's going to think of a question in 10 minutes from now. Ceci, one more thing. Since all of them were on the reset, and this is a new thing, Ceci, we could talk about, there's a fasting video that's just the implementation of fasting. When they're done with their reset, make sure we send them that fasting video, and we can go over that afterwards too as well. You guys probably—
I had one more question, Doctor.
Sure. Yeah.
On that list we got to the welcome page, there's options of students and warriors. Are we considered warriors?
Yes, you would not be on this call.
Okay.
Yeah. And now that Ceci's here, if you guys have any more questions on the differences, she can go over that because I got to jump on my next call. But yes, you guys are warriors. So that's above students, and the students don't have access to these smaller calls. It's like a higher level of access, guarantee of results.
Okay, perfect. Did you ladies have any other questions at all?
Because I didn't get my medication yet, right? It was sent to the prescriber.
Yeah.
Since I'm on the recess,
The
should I?
reset, you won't take any of the medication. So even if you did receive it, you won't start until we get your calories up, and then we'll let you know when to go ahead and start that medication.
Okay. Okay.
It's worth it, I promise. I've been doing the program myself, so I've been in 2 resets. So it takes some time and it might get a little frustrating at times, but don't worry. Any questions that you might have, feel free to go ahead and reach out to us, and then we'll walk you through it. And it's definitely worth it, especially when you're under eating. Then when you get your calories up to that point that you need it to be at, it'll really help get through those 48 hours for your fast.
If you guys enjoyed watching this video, then you're going to want to check this one out. I get into a deep dive over GLP-1 medications, peptides, and lasting weight loss, guys. We'll see you later.